Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting this press conference in Spanish. His interpretation will be available on the county's website and the YouTube page shortly after we conclude the press conference. We're here again to provide you with the most up-to-date information about COVID-19 in Santa Barbara County. Today is the beginning of another week of staying at home and working together as a community to protect the health of ourselves and our loved ones. We are all wondering how long this will last. Many of us are anxious about the disruption of work, school, and other aspects of our daily lives. Many of us are also very worried about the health of people we know who are experiencing symptoms of COVID-19. The best way for us to counter these very real concerns is by taking seriously the need to stay home and practice physical distancing. These actions are necessary for controlling the spread of the virus and making progress toward eventually moving into the next phase of the COVID-19 response, the gradual easing of aspects of the governor's stay-at-home order. I recognize that the stress of COVID-19 is increasing with each additional week that we are experiencing this unprecedented emergency. Many Santa Barbara County residents are suffering enormous financial hardship right now from the gap in time between lost paychecks and the delays in receiving federal stimulus checks or unemployment insurance benefits. Over the past week, many residents received the $1,200 stimulus checks from the federal government. If you have not yet received your check and want to inquire on the status of it, or if you have not recently filed a tax return and need to provide banking information, please visit irs.gov/coronavirus/getmypayment. That's irs.gov, and then you can actually see the additional links right there on their main website. Workers who've been economically displaced as a result of COVID-19 can receive an additional $600 per week in unemployment insurance benefits. If you're out of work, please complete the State Unemployment Development Department's online application process. If you experience delays in the application process, please don't get discouraged and give up. The state is increasing call-line staffing starting today to reduce wait times and help answer questions that you may have. There have also been issues with the website and email addresses because of the enormous volume of inquiries. This important financial help will make an enormous difference to your personal financial situation, so please be persistent to trying to get into the system. Our federal representatives are working on new legislation to provide additional assistance and economic assistance to local small businesses from the Small Business Administration and the Paycheck Protection Program loans. One important benefit that is often overlooked is the California Earned Income Tax Credit Program. Many Santa Barbara County residents, especially the lowest income workers, may not realize that they are eligible to receive up to $8,000 from this program. Community members can qualify by filing their state income tax forms, and with the state and federal tax filing deadlines pushed back to July 15th, many people may not realize they could get help now by filing their state tax return right away. In 2019, there were 19,000 Santa Barbara County residents who claimed a collective nearly $4 million from the California Earned Income Tax Credit Program. This year, the Franchise Tax Board estimates 30,000 low-income earners in Santa Barbara County will receive nearly $9 million from this $1 billion statewide pot. This year, an estimated 7 million Californians, including more than 1 million children, can benefit from the California Earned Income Tax Credit. To find out if you qualify, visit caletc4me.org. That's CALEITC4me.org. Last week, Governor Newsom announced the allocation of $75 million for economic assistance for undocumented Californians as part of the state's disaster relief fund. The grant makers concerned with immigrants and refugees networks has also committed to raising an additional $50 million for the relief fund for a total of $125 million. Through this fund, undocumented adults will be eligible to receive $500 checks for a maximum of $1,000 per household. Local nonprofit organizations with existing connections to our immigrant communities will take part in helping disperse these assistance checks. The assistance checks will be made available beginning in May. This assistance is incredibly important as our undocumented neighbors do not qualify for unemployment insurance, the federal stimulus checks that are being sent out, or other government assistance programs. Please visit covid19.ca.gov, that's covid19.ca.gov, to access the state's new guide for immigrant Californians. I'd like to close my comments today by highlighting the need for everyone to fill out the census. This is an important action that is simple, that can help all of us, that we can all take right now to ensure that our community receives the resources for important public services. Having a complete count will be critical for our recovery efforts in after the COVID-19 pandemic. The census determines the federal and state funding Santa Barbara County receives for critical public services like healthcare, hospitals, fire prevention, emergency preparedness, law enforcement, and road repairs. It only takes a few minutes to fill out your census form online at census.gov. Everyone has likely received a number of census reminders in the mail. Please take a moment today to complete your household census form. There could not be a more challenging moment to communicate the need to complete the census than during a pandemic. I know you are following the governor's stay-at-home order, so please make it a top priority to get online and finish your census form. Like our response to COVID-19, we are stronger together. Next, I'd like to hear from Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. Unfortunately, we have to report that one additional patient with COVID-19 died on Friday. This person was incarcerated at the federal prison in Lompoc and was part of the identified outbreak. We want to express our sincere condolences to their family and loved ones. We are reporting 22 new cases of COVID-19 in Santa Barbara County today. 14 of the new cases are linked to the federal prison outbreak in Lompoc. Of the 416 total cases, 168 are recovering at home, 43 are hospitalized with 15 patients in the intensive care unit. 176 have fully recovered. 4 people have unfortunately died. The ages of our new cases range from the 20s to over 70 years of age. The federal and state governments have provided a plan for rolling back some social distancing measures and for reopening the country's economy through several phases. Under these guidelines, states will need to meet 6 metrics that include demonstrating a downward trajectory of COVID-19 cases over a 14-day period and a robust system for testing healthcare workers and others before they can proceed with a transition. We are examining these metrics closely, along with our local case data, to make the most informed decisions for our county. The situation at the federal prison in Lompoc is managed as well as possible under the circumstances, due to an excellent cooperation between the hospitals, the Bureau of Prisons, and the Public Health Department. Our community is supportive of the stay-at-home order, and this is reflected in the stabilization of hospitalizations and intensive care unit admissions. Although you may not see a large number of cases in your own community, please know that COVID-19 is circulating, and your physical distancing efforts are the only way to slow its spread. We appreciate how hard it can be to continue with our stay-at-home directives. Please be patient and continue with these very important measures. It is much easier to get the timing of the loosening of these measures right than to see a surge of cases and fatalities and having to be even more restrictive for a longer time if we were to open too soon. Thank you.
Thank you, Dr. Ansorg. I also invited Laurie Goodman, who's the Executive Director of the Isla Vista Youth Projects, to join us today. Laurie's dedicated team serves the residents in need in Isla Vista and throughout the entire Goleta Valley. She is leading a multi-agency nonprofit collaboration effort to better coordinate service delivery and response to COVID-19 in our community. In addition to all her critically important community work, Laurie is also a huge Jeopardy fan and is one of the very small number of Santa Barbara County residents who've been contestants on the show. I know her wide-ranging knowledge helps her in our community work, and I'm curious what insights she has for us about ways families can cope during the governor's stay-at-home order. Welcome, Laurie.
Thank you. Thank you, Greg. It's great to be here, and I really appreciate your inviting me. IVYP is committed to mitigating the effects of poverty, racism, and trauma by providing comprehensive, high-quality childcare, culturally sensitive family support, and visionary community leadership. So when we made the decision to close our Children's Center on March 13th, we had to really take a step back and think about how do we continue to fulfill our mission and to fulfill our work during that time. So childcare, normally we serve 127 children 0 to 5, and then another 250 children at Isla Vista Elementary School and at El Camino Elementary School. So we quickly rejiggered all of our work to develop a really comprehensive section of our website to provide resources for our school-age children and to do individual outreach and family support to our Children's Center families. Our Family Resource Center, which is located in Old Town, immediately focused all of its work on the most urgent needs of our families. And as you mentioned, many more people are experiencing crisis in their lives than normal. In a normal month, we distribute food to approximately 150 individuals. In the last quarter, we've distributed food to over 1,000 individuals. Just last week, we had one day with 72 families coming in, over 200 people in that family. So the first thing we did was work on food security. We're doing food distribution by appointment in our Family Resource Center. And then as people started to lose their jobs, we've also shifted to helping them apply for the funds that are available through either 805 and DocuFund or the COVID-19 response fund that United Way is hosting. And then we do community leadership. So what that has meant is that we've really activated our networks. Every week I convene a gathering via Zoom of the Goleta Valley Community Partnership, and that includes people from the city of Goleta, from the Isla Vista Community Services District, from Goleta Union School District, from the county, as well as other nonprofits. And we share what the needs are, what the resources are. It's an opportunity to provide support to one another and to make sure that we're meeting the needs of our community. One of the first needs that came up that shouldn't be surprising, but really was the need for computer access. And I know that the school district has talked about it, but if you don't have a child in school and you're working, let's say you're a child care worker, or you have a young child, you still need access to a computer, or you're a senior. We've partnered with Equalitech, which is an amazing organization also based in Goleta, to get Chromebooks into the hands of our teachers so they can better communicate with our families. I'm really focused on that digital divide and what a difference that makes if people don't have access to computer and they don't have computer literacy. We're bringing people together. The other network that has really been activated at this time is the network of Family Resource Centers. And at this time, I'm working to connect a new food resource to Family Resource Centers across the county. I'm not sure that I can say so much about it, but this week I think we'll be providing 1,000 meals in Goleta, hot meals from restaurants. And we're looking to expand that to Carpinteria, Lompoc, Santa Maria, Guadalupe, Cuyama, and the San Ynez Valley in the next week. So that's not me doing it, that's my networking, able to bring a resource, a new resource into our community. So I'm so proud of the work we're doing. Extraordinary times call for extraordinary measures, and I feel that IVYP is stepping up to meet the needs in our community.
Thank you, Laurie, for sharing all the wonderful work that the Isla Vista Youth Projects is doing and your whole team of collaborators in the Goleta Valley. We appreciate that. And there are lessons for the whole county in the work that you're doing about collaborating and working together. With that, we'll take questions in the room. Ms. Laird, do you have a question?
I have two questions. To begin with, Dr. Answer, you were talking about the need to shelter, and there is a petition going around called Fully Open California, talking about rallying on Friday at noon at city halls and capitals. I haven't seen it happen in Santa Barbara, but I have heard Thousand Oaks is one of those locations. In a nutshell, can you explain how contagious this is and what you would say to those folks?
Well, the virus is very contagious and it is spreading in the community. The virus is most contagious the day before we become symptomatic, so nobody really knows when they spread the virus, and it can affect young people, otherwise healthy people, obviously people who are a little bit advanced in their age or have underlying health conditions usually have a rougher go and are more likely to develop serious symptoms that require hospitalizations. Having said that, there is a number of patients who were young and healthy who came down really hard with COVID here in our communities, and it does not make any sense to undermine the efforts that the community has so far successfully done. And I think those people would need some re-education on the facts of the situation we are in.
And my other question is to you, Laurie. Do you have a tip for the families? You're doing this interactiveness, and I just wondered, a lot of people are working at home and they're trying to do the child thing. Do you have any tips that are working?
Well, I would say be kind to yourself as a parent. You don't need to be the perfect teacher. It's okay if your child's having a little more screen time. And to remember that these are children, not little adults. So when they interrupt you, it's not because they don't respect you, it's because they want your attention. That's normal for a child. Everyone is stressed, and our children take our cues from us. So everything you can do to care for yourself is also going to help your family.
Thank you.
Thank you. Mr. Molina?
There was a Stanford, LA County study that was released today that suggested that as much as 5.6% of the LA County population showed COVID-19 antibodies. And I'm wondering, do we have any idea, Santa Barbara County, of the number of people who may be in a similar situation? In other words, may have it and don't know that they have it.
There was also a study out of Santa Clara, and they had slightly lower numbers. The problem I see with this test that is used is that it is not very specific to just this particular novel coronavirus. It's possible that it picks up some seasonal coronavirus antibodies as well, and that would change the numbers. Numbers from out of China and out of some European countries, Austria, Denmark, show that they expect a lower percentage of the population having had the actual novel coronavirus. It's around the 1% range. We will, in the near future, once we have a reliable serum antibody test available, we will get very reliable numbers at that point. It's a good beginning, but it's unfortunately just a pilot study, so it has to be verified with others.
Okay, just one more question. Do we have an update on when the hospital might open at the Lompoc Penitentiary?
I'm not aware of any timeline there. I'm sorry.
I heard today earlier that they were aiming to try to be open by this Friday, but that there were some staffing issues about that. But I think that they're hopeful to have the physical building ready to go by Friday.
Okay, that's all, thank you.
Any other questions here in the room? We can next go to questions on the phone.
Yes, first up, we have Nick Masuda with Santa Barbara News Press, to be followed by Tom Bolton at Newshawk. Go ahead, Nick.
Thank you. I have 4 questions, and actually they're all on kind of different topics. But last week, Dr. Ansor, you had said that that potentially in the North County is because people might not be following social distancing as well, that maybe that's the reason why 80% of the cases are up there. But could it also be that there is more testing happening in the North County?
That is a good question, because we do not have exact tally of every test that has been done, especially in the North County, because they utilize different send-out labs than the South County. We do have some data out of our epidemiology section here from Public Health, and they show that 60% versus 40%, to my knowledge, were members of the Hispanic community. But there is no, those are aggregate numbers, and that does not divide between North and South County.
And Mr. Masuda,
Okay.
there'll be some additional information about the demographics from the county's Department of Public Health tomorrow at the Board of Supervisors meeting, so you might want to tune into that to get some additional information.
Great. Earlier today, and I also, we talked over the weekend, the 68-room hotel that is now going to be procured for non-COVID patients, the city had kind of pushed off to the county as to if there was a homeless person that did test positive, where would they go if they weren't needed to be hospitalized?
Well, today, the county is opening up a non-congregate care facility for people who are experiencing homelessness. It is a 70-room existing hotel in Santa Barbara, and that facility will be available for folks who are vulnerable to COVID-19, folks who are experiencing homelessness and who are positive for COVID-19. I believe there are individual hotel rooms that are also being used as quarantine facilities for those individuals if they do not have a home.
Okay. A reader actually sent a great question over the weekend. Is there a possibility of breaking down where the healthcare workers that are positive have tested positive to kind of give an indication as to where those are happening?
No, unfortunately, that is a detail that we cannot disclose, and it's also very difficult to find out because of the caseload. We have 51 healthcare workers who came down with COVID in Santa Barbara County.
And the final question, and you guys might not have an answer to this, there's fencing being put up at Campus Point currently. Is that being done by the county or somebody local there because work is being done there?
That is not related to closing the beach. That is work that was originally scheduled that is just a temporary construction project.
Thank you so much.
Thank you, Mr. Masuda.
Tom Bolton with Newshawk, go ahead.
Hi, good afternoon. I have 2 questions today. My first one is wondering if you can give us an update on where we stand as a community in terms of the personal protective equipment and ventilators and whatnot. There was quite a push. People were being asked for donations, et cetera. Where do we stand today? And I appreciate if you could be as specific as possible.
Well, with regard to ventilators, we have currently 15 patients in an intensive care unit, and not all of them require a ventilator at the moment. So, per my last per my recollection, we have over 60 functional ventilators in the county. So we are definitely not at maximum capacity at the moment, and we don't want to be, don't get me wrong. But we feel confident that we can keep the virus spread at this level, that the hospitals locally will be able to provide the necessary care needed for very sick neighbors.
What about other sorts of protective equipment, gloves and masks for medical people, et cetera? Again, they were asking for donations a few weeks back, and has that supply situation changed?
To my knowledge, it has improved greatly, and we thank for the generous donations that have made a difference. And I would have to check back in with our emergency director to find out more details on that. But per my knowledge, there is no extreme bottleneck at the moment. Thank you.
Okay, yeah, maybe at a future briefing, you can kind of update us on that. I think there is some interest in that. My second question involves, it's somewhat anecdotal, I suppose, but it looks like over the last few days, we've seen a increased number of patients in the lower age groups. And I'm wondering if you have any sense of why that might be happening. Is it purely coincidental, or is there some other trend there?
Well, I don't have any hard facts, but I've noticed that the younger age group does not abide by the social distancing as well as the more gray-haired population. And I think it shows in a higher rate of infection, unfortunately. So I just implore the young people in the county to take this seriously, because young age does not protect us from catching this virus, unfortunately.
All righty, thank you very much.
Thank you, Mr. Bolton.
We have time for one more question. Raisa with San Ynez Valley Star, go ahead.
Thank you so much. Can you hear me?
Yes, we can.
Okay, thanks. When you get the okay from the state to start lifting the restrictions, have you thought about where in Santa Barbara County would be first to be, lifted somewhat, and what kinds of businesses those might be as well?
We are working, the County of Santa Barbara, the Public Health Department, the Emergency Management Offices, and you will hear more information about this tomorrow at the Board of Supervisors meeting, but the plan is to develop a comprehensive framework that Santa Barbara County can use to roll through the governor's 6-point framework for reopening the state. We're going to be looking for clues from the state of California as to how to begin that process, but we are making plans now to make sure that Santa Barbara County is ready for that moment. We want to make sure we are properly resourced, that we have the testing capability, and that we have the staff to be able to do tracking and tracing and isolating and quarantining of COVID-19 patients if there is a surge when folks are closer together in the future. So we are preparing, and we're going to have a stakeholders participation element from the business community in that plan. And that will, again, more details will be available about that tomorrow at the Board of Supervisors meeting. But I don't anticipate that there will be significant geographical distance differences in that plan, more industry specific, and the type of job and work environment that would be affected by those new plans.
Great, thank you so much.
That is all the questions we have.
All right, well, thank you very much for being here today. This concludes our press conference. Our next press conference will be held Wednesday at 4:30. As I mentioned a couple of times, tomorrow morning at the Board of Supervisors meeting at 9 a.m. The board will be hearing and discussing the county's response to COVID-19. There will be some additional information from public health about the demographics of the patients who have contracted the virus. The phone numbers and websites of the information sources and resources will scroll on the television screen after the conclusion of our press conference on the channel, the county's television channel 20. And thank you all for being with us today.